One point in my talks that I give to most of my partners and most of my employees is regarding health. But more specific than health is the value-based health that we should provide here. And the focus that we have most of the time is on the bottom line of the hospital. How much salary you're paying to the doctors, the nurses, the marketing staff. It's not focused on the patient and their health and their value. Some hospitals are, some hospitals aren't. And when they want to increase the revenue, increase the bottom line, then they increase the prices for the doctor's fees, for the medicine, for the services. But that can only last for so long because the patients will see that the value is not there and leave. So one thing that I have tried to focus on is patient-focused services. And how do we do that? And most of the time is that we have to change the concept of health, our view of health. So what does health mean in reality? Healthy, being healthy mean? A lot of times it means not having sickness. But the real health, in my mind, is the full state of physical, mental, and state of well-being. And of course not having any sicknesses. That is a whole picture of what health should mean to us as hospital administrators. And so one thing it starts with is the management of the hospital. The management of the hospital, how are they creating the environment and empowering the employees, the doctors and nurses. And so, for example, is one story from the Ritz-Carlton. You know, they have a famous saying for they have the best service everywhere. But one story is that they empower their employees with the responsibility to own each complaint. And I heard one item or one story that impacted me deeply was that one family stayed at the Ritz-Carlton and they left their favorite doll at one of the pools, and then they went back, and they live in a completely different country, and they called the Ritz-Carlton and they asked, I'm sorry, were you able to find this doll that my son left, and I can pay for it to have it sent back to us? And the person that was in charge that received the call and received the complaint, or for the, not the complaint, but the customer service for the person, was able to find the doll. And not only did they send it back to them, but what they did was they took pictures of him laying out the doll, by all means, laying out by the beach, taking some room service, getting a massage, and saying in some words that they're having a very good time, sending a video and some pictures and sending it back along with the actual doll for free, which the Ritz-Carlton actually paid for themselves. So, and that is the ownership of an employee, of them feeling that they can empower and they're free to do as they see fit in order to make the customer or patient happy. And that's not only helping, you know, of course we're in a hospital setting, but that type of customer service, that type of focus on not only that, okay, I have to give you the doll back, but also focus on how they're feeling emotionally as a kid and as a family, as a parent, and how to go overboard with the customer service. And that's when we're dealing with patient services. It's one thing that I want to focus on is not only that they have sickness or not sick, but how they're feeling emotionally, how to touch them emotionally. And that's to focus on our own concept of health and how we design the patient experience for them. Thank you very much.